So I'm going to keep an eye on letting everybody admit. So while they're still coming in, I'm going to go around the room and, figuratively speaking, and just ask people to introduce themselves. So we're going to be really fair about this. We're going to have alphabetical order. So Paula, would you mind going first and telling us who you are and where you're from, please?
Hello, I'm Paula Baird, Programme Lead for Building Digital Skills and Leadership. So specific programme of work with specific delivery priorities that it's aligned to the digital health and care strategy. Thank you.
Lovely, thank you. And Kieran?
Good evening, folks. So I'm Kieran Egan. I'm a Senior Research Fellow at the University of Strathclyde. I work in the Computer and Information Sciences department. I'm particularly working in digital health and wellness. Some of the topics that I'll be talking about today are innovations around the space of carers, so unpaid carers, and also dementia. And it's great to be part of this. Thanks.
Excellent, thank you. And Alan?
Hi folks, I'm Alan Milburn. I'm the Policy Manager for Digital Skills and Leadership at the Scottish Government. I've been on this journey for quite a while. I work very closely with Paula Baird and the rest of the team at NES on the delivery of the programme. So from my side, it's more the strategic side of the user-led design in amongst all our great governance that we've got now across digital health and care to really get the strategy to take shape. So we've got a programme of work, but we're always building that communication and engagement piece through our governance to really get this off the ground that it has been delivering for some time, and I hope to share some of that at this session.
Lovely, it'll be great to have the examples coming through from everyone as well. And last but definitely not least, my colleague Mark.
Yeah, evening all. I'm Mark Walton. I'm a Programme Manager at Programme Management Services with NHS National Services Scotland. I'm part of the Service Design Hub there, doing as you can imagine, service design work, but I'm currently as well leading the BA lean team that we're setting up as part of the engagement to help look at services and how they work.
Brilliant, Mark, thank you. And the thing I always forget to do is to introduce myself. My name's Katie McClure. I'm current chair of British Computer Society Health and Care Scotland, and the previous chair is also on the call. Sharon, are you going to speak to us?
No, just to introduce myself. Sharon Levy, I'm part of the Asher Institute at Edinburgh University and one of Katie's sidekicks. That's it.
Sharon's the one who has the ideas. He's very inventive that way. Folks, let's get this started because we've just got the hour and we've got lots and lots of people on who want to hear from you. So we're going to go round each of you and I want to hear from you. What sort of approaches you use for user-centered design? Tell people about the tools and approaches you use. I've given you 5 minutes each. Don't feel we need to use the 5, or somebody can have 6 and somebody can have 4. We'll keep it casual. And hopefully that'll then prompt questions from the audience. And Sharon's very good with questions as well. That's another bit about him. So we'll get the conversation going and I hope you'll join us and put those questions into the chat or the Q&A. I'm trying to remember which, it's Zoom we're on today, probably chat. Okay, so we're going to, I think let's do the reverse order. Keaton's surprised because Mark doesn't know that I'm going to go to him first and say, tell us about user-centered design approaches that you've used, Mark, and tools that you prefer. So you've got 5 minutes, Mark, go for it.
Thanks, Katie. You always do this to people, don't you? Thank you. I think one of the things as a project manager, I've done quite a few things over the years, looking at service improvements and also looking at how we implement new systems and new processes of work. I think one of the key things I always do is try to understand how things should work and how they do in the real world. So a lot of taking on the lean experience, engaging with people who are actually doing the job, not just looking at what they're meant to do, but actually looking at what they do, how they actually work, what workarounds they maybe need to do, and take their ideas forward as part of that, looking at how we can take things forward. So quite a bit of process mapping and understanding that whole approach so that when you are looking then at how you take it in, you're getting the solutions from the people that are doing the job, and you want as much of that information out of them as you can. That sort of then goes in when we are looking at doing sort of service design, when we're looking at understanding where things can go in terms of new services, and understanding that is to get as many people engaged as you can. You want as wide a group in there, not just those that are actually doing the work, which is very much what I would have done previously with the lean work, but you want to get that understanding from everyone else. So actually the last project I worked on with Katie, we had a huge range of things that we were looking at in there, from interviews and engaging with people, not just with service users, but also trying to get out to the end users as well. So we were looking at surveys in that, we were doing opinion polls, just trying to capture as much information. You want as many views in there as you can, and you want them from as wide a group as possible. So one of the things we found with doing the surveys quite often was, is it representative? We had one piece of work recently where 2/3 of the survey responses came from one group. How do you know they're real? You've just got to test it. Look at it as much as you can, split the results down. If you get the same trends, you get the same trends. I can feel myself starting to waffle here, but I think ultimately, from my perspective, if you want to get success, you've got to know where you're going. You've got to know what your end in mind position is. You've got to know who's involved, and you've got to take those people along a journey to get from A to B. And I think the other guys, I know from some of the projects that they'll probably come on and talk about, because we've had a chat previously, we'll expand on a few of those. But it is that journey. And the best people to take you on the journey are the people that are doing it and the people that are using it. They're the ones that can generally see what's going wrong, and they also understand what they need.
And that's why we need user-centered design. Lovely to have that introduction. Thank you, Mark. You've got us started off. And Alan, would you like to go next, please?
Thanks, Katie. I'll not steal Paula's thunder, because there are a couple of examples in the programme. I think Paula's going to talk about them. But what I will say, just on the back of what's just been said, if I can throw this line in, I mean, we could, from the strategic side, the user-led research, if you like, or the user input, really comes from the feedback that we most require, from everyone on this digital health and care journey. I would say that, from the strategic side, it's around. I could say we could build as much, but when it comes to digital skills training, digital leadership, we could build and build and build. But what we have to keep a grasp on is what is coming around the corner, what technology is emerging, what's in that pipeline. And rather than be something's at the tail end of that, what our service users and patients want, we should really be proactive on that. But that proactive element will only really come in once we really start embracing and sharing information. And I've said this quite a few times at many forums I've been on and many meetings, that there's a lot of stuff out there. There's a lot of people doing good work. There's a lot of user research. There's a lot of people feeding in. But sometimes in Scottish Government, in the middle in the programme, we don't get to hear about that. So we have a great governance structure there, but we're still adamant that we're going to make it work better than it currently does. It works pretty well. It's fairly new, but we really need to pull it together. We've got a digital, we've got the digital citizens on one side. We've got the digital technology on the other side. We've got the workforce sitting in the middle, and that whole piece together really drives us forward. So it's about bringing this in, no matter how small a project is, or how low impact some people might think it is. We want to hear about it, and that's why we set up the programme board and the reference group on top of that. So again, these groups are there. We're determined to make them work better. They should be a more practical input to this, especially around the reference group, and we're still looking at that. Great membership, great people. It's up to us to lead that. But again, we can only lead it if we know what's out there and we bring that in. The whole key to this really is avoiding duplication. We've got limited resources. When I say limited resources, we've got limited finance. We've not got limited resources, because there are great resources out there in the people themselves. But the finance, the financial situation is very tight, as we know. So we need to share this. As I say, avoiding duplication and making the most of what we have is key, to the actual success of this transformation piece.
Very true, and raises 2 points for me. One, I've very remiss in not mentioning that this is one of the Digifest 22 satellite sessions tonight as well. Ness is on and she's going to tell me later that I didn't say that. So Digifest 22 was wonderful last week and we heard about so many projects. It was amazing. And the second point was, I read somewhere today that somebody said, if you're asking the same questions of the same people more than once, that's not them being heard. It's actually counterproductive because we're not building on it and what they've been saying. And Kieran, we're over to you now.
Thank you very much, Katie. I think from my perspective, I really do align with some of the conversation there already about some tools that are out there and the way that you collate information, from user groups. So for context, we've been working at Strathclyde on work around carers, and this is informal carers, so unpaid carers, and there's 700,000 at least across Scotland. And they're a very, very diverse group, and they're doing a lot. They don't keep well physically, they don't keep well mentally, and getting that representation that Mark already alluded to, I think that's a constant challenge, because you're always trying to work out who are you speaking to and how accessible are the people who really need the help of the things that you're designing. And I think that's a constant evolving conversation. I mean, we use often, we've kind of veered, I suppose, more towards the co-design and that element of trying to equip individuals in that project with the knowledge, with the skill sets to kind of come forward and say what they'd like. I think sometimes with that specific project, when you're ideating and you're coming up with the art of the possible in these future kind of technologies or what phones can offer, I think it can be really difficult for individuals off the bat to kind of come in and just say, well, this is what I think I need, or that's what I think I need. So we spend a lot of time having that conversation, just like we're doing just now, and then maybe having a follow-up survey, just equipping and kind of building that knowledge base with your users so as they can come back to you, so as you can understand the problem. And that's often mirrored with systematic reviews, reviewing literature, seeing what's out there. Sometimes it's understanding what technologies people are already using. If you're using Facebook day in, day out, or Instagram, or any of the kind of big names out there, you probably don't want another system to learn, another a whole load of procedures to go through. So you've got to think about what they're used to. We have to, I suppose, we develop a lot of user stories from personas, and they're always kind of evidence-based. So we try and get a capture. So we do kind of national polls and so on. We do, we look at often, for example, within this study here that we've been doing, we've been looking at behavioural change models and thinking about where people are on their map of behavioural change and thinking about that goal. So working with the users to help them get to a destination that's, I guess, a smart objective, saying, with one of our kind of first studies, we did 3 weeks of behavioural change. Where do you want to get to at the end of that 3 weeks? What's realistic? How can we adapt it? So there's things out there like the Hemingway app, you can put text into and it can reduce the complexity. It's trying to make it accessible. And a lot of our focus now is increasing that accessibility by integrating things like videos, things that components that would make it fun, interesting to kind of develop and use on a regular basis. I think there's other aspects of kind of learning from our users. Definitely the evaluation is a strong area of focus. Whether we're seeing, do people want to use it? Has it got utility in their life? Is it usable in the first place? So we might use metrics like system usability scale, but we might use others. And I think there's a big piece of kind of conversation about integrating all these different voices. I find it quite an interesting area of research of, well, who is the most important group that you're speaking to, or how do you integrate, maybe you've got professionals saying one thing and you've got, for our example here, carers saying another. So there's a lot that, I'm constantly learning and learning and sharing with others and then talking about, because I think getting it right for everyone all the time is actually really, really challenging, but it's coming back to your user base. It's coming back to those users, which kind of Mark started on there, that I think is absolutely of paramount importance. That's me for now. Thank you.
Thanks, Kieran. That's excellent. Yeah, it's about adding value, isn't it? How do we capture that user-centeredness and add value to what we do as we go along? Paula, what would you like to add?
Thank you, Katie. One of the priorities within our programme is how we build a central platform for digital skills resources. For learners, they've got to go to many places and spend time searching for the resources and then not knowing what's the right or best resources to use. So our approach for building the platform is through the lens of the learner and user-centred design. So we're working with a technical partner, and the first 2 phases we've completed as user research. So we did one-to-ones, workshops, specific survey, which reached about 4,500 people across the workforce in health and care. From that, we then built the personas of the people that would be using the digital skills platform. And then the stage we're at now is mapping the learning pathways to identify the pain points that learners have to then overcome those pain points with the technology within the platform. So we'll build a low fidelity prototype to look at what the platform will look like. And then we'll go into platform options and architectures, and then ultimately the user interface with the development. And that works also in line with developments that are going on with the features and functions within Touris as well. So whilst we take that approach and then we promote that approach so people are learning from how we're doing that and designing the platform, within our digital health and care leadership programme, we've now included a service design module. And that's to introduce and explore the value of design and creative practice for the development of health and care services. Because part of the programme is participants will identify and deliver a digital health and care technology project as part of that programme. And then we're also working with Sharon, Edinburgh University, on designing our Leading Digital Transformation in Health and Care for Scotland Masters programme. And within the certificate and diploma section, there's introducing the fundamentals of user-centred design and person-centred service delivery. So it's threaded through everything that we're doing as part of the delivery. Thank you.
That sounds amazing. That sounds really good. Any reactions in the panel about what each other have been saying? Would you like to get your tuppence in there first before we go over to the questions that are coming in the chat?
I think it's interesting when all of us talk about service design, it's the same approach and methodology that's used, and it's about sharing that to then how we engage others to do that, to design services from the outside rather than designing services from the inside out.
Yeah, so it's all user-centred. Do we differ in any of those sort of approaches that we do, or are we just giving them different names?
I think there will also be, depending on what you're building, whether it's a product or a service, there will be some differences. And I think there is differences in the terminology that is sometimes used, just depending on how people have learned or who they're working with as well.
Yeah, that's true. The background you come from and whether you've had the opportunity to actually get totally involved and get the time and space to actually adopt that user-centeredness. Sometimes it's lost in academic research, Kieran. I'm delighted to hear that you're embracing it where you are at University of Strathclyde.
I mean, you've got particularly working. I mean, a lot of my work there would be with older adults, people with dementia, with caregivers, and I think the thing is, you know, that you've got to listen to what they actually want, and you've got to keep them involved throughout the whole kind of design process. And that's it's also the post-design stage when you're still learning just from general use and so on, because I think otherwise you just end up, you can have great ideas, but you need to be critical, and you know, it's your audience who are going to be critical. They're going to vote with their feet. There's lots of things out there, and you know, I guess part of it's advertising why your product or your solution is so suitable for the audience that you've designed it for. But part of that, you know, I feel like it's full circle. Get them involved very, very early. It's not tokenistic. It's really, you know, there's so many genuine ways to do it now, but it saves the kind of the the uncertainty in the long run, because you get answers to, it's very easy to ask some very simple questions. Would you use this? Why would you not use it? How often would you use this? What are things that we could do? These kind of questions, they're not, it feels so simplistic, but it can be, if they're missed, it can have such a big impact.
Yeah, very true. Stephen Booth is asking, how do you combat just getting responses from the usual suspects, he says, the small minority are motivated, engaged, and have the spare time to get involved, so probably atypical. And I would actually say I fill in every survey that's on the go, Stephen. So yeah, and part of that's just professional curiosity to see how they're designing them. And I don't suppose many of them have actually had the users involved in designing them. So folks in the panel, how do we combat just hearing from the usual suspects?
With difficulty. I think it's always hard to do it. I think you will have the people that will put themselves forward in projects. You need to engage with them as much as you can. I think it comes back, and I think I'm going to use you need to educate everyone in the team, everyone in the project, from the sponsor right down, as to the benefits, as to why they should use it, if it's the right approach, and if you should be using it. But I would say as well, if you've got willing suspects and willing engagements, try and use their wider networks. They will have networks that you don't have access to. See if you can tap into them, if they're willing to share and they're willing to spread the word for you, especially if you've sort of been working closely with them to design a survey or design an information capture that you can send out. And just try and get as much back as you can. Utilize your networks as much as you can. But also it comes back to what was said earlier. You don't want to keep asking the same people the same questions. So do your homework. A good desk study, speak to colleagues, speak to professional networks, see what's been done in the past and see what you can use as part of your background and build upon.
Yeah. Alan's chipped in here. He says, the usual suspect, do we need to think about paying for people's time and travel? And if you think about it ethically, the answer, Alan's yes. Other Alan on the panel, do we have the resource? Do we have the money to do these things?
I would like to say, probably not.
Putting you on the spot there, sorry.
No, probably not. I would say, well, we're in a digital age, so we should be doing everything in that way. But I think just to build on what was said there, I think it's just about getting the pitch right. Sometimes you can get a wee bit fatigued on that kind of stuff. So here's another, I don't think I've got to feed into here, somebody else. But so sometimes it's just about a whole refreshment of it, and sometimes given the overall, I always feel that given the overall benefit and the overall thrust at the beginning of something is something that's sometimes missed. Some of these things can be just a wee bit dry. In the past, we've done quite a few surveys right at the beginning of this digital skills and leadership journey, and they didn't really tell us anything apart from things that we already knew. So, and it's only now, in recent times, that we're actually managed to gauge quite a decent response. Some of that was contracted out, so we got some experts to do stuff for us. So sometimes you do have to just spend the money and get that buy-in, to get that buy-in. So it's just about the balance of that. But resources are tight, but I dare say sometimes the collaboration side is sometimes key as well. It might take more than just the usual suspects that you normally link up with, and just broaden it out a wee bit. And that's why I said, because a lot of the journey that we had done to date was predominantly across health. We were comfortable working with health boards, but I've done it for a long time. And now that we've got the care aspect, which is still fairly new, that to some degree was quite a grey area. Some of it still is a grey area, when we're trying to branch out. That's why you have to start from somewhere. So anything we do with something, we might choose a few pilot areas or test areas to test stuff out, and then you can build it from there. So again, sometimes putting stuff out en masse can be a bit, use a test bed first. We've done that as well in some key areas. So we're always thinking on our feet and trying to change the way that we did it before. It's no easy, because a lot of stuff we do, we don't get as much as feedback as what we would want. But we are better, in the last couple of years, especially since the pandemic, than we ever were before.
Yeah, Nessa's saying that the Alliance have done amazing things with very small amounts of money, so there's hope for all of us around that. An interesting point has been raised, Sharon. I'm not avoiding your question, I'm just doing them in the wrong order. It was an interesting one also from Stephen, so you're getting two in here, Stephen. How do we eliminate senior managers who want to wear the user-centered badge, but they basically tell you what people want? And they say we don't need to go and speak to the actual users. How do we overcome that?
Send them on a digital leadership course.
That's what I was going to say.
And we've got plans
education.
for that.
Especially with a service design module in it.
Yeah.
Get them to speak to people who've actually used the services of user designers and been successful in producing the products and services, potentially. Kieran, how do you introduce students to it?
Sorry, the question, to introduce students to
user-centered design. Do they
I mean,
take to it quite naturally? Is it?
Yeah, I mean, so my personal, I think there's kind of other colleagues will be involved really kind of in more depth in teaching user-centered design across a variety of different applications. I mean, I definitely talk about kind of, you know, maybe the other side of the spectrum of kind of more puristic co-design in kind of older adults, and I can talk about that. And certainly, I think that when you look at the diversity of the populations that we're trying to support, with concurrent conditions, with different kind of vision, kind of hearing, different kind of abilities, I get the feeling that the co-design involvement, or this kind of discussion of getting users involved early, I think it makes a very, very convincing argument. Nobody's come to me and said, I really don't think we need that. That seems like superfluous. And we talk about technology and how it's advancing as well in some of the courses that I'm teaching on. And actually we're kind of agnostic to the technology. It doesn't matter. I think Alan was saying earlier about, you know, as technology advances, we're trying to navigate through it, and tomorrow it might be VR, or, you know, it might be something AI, you know, beyond what we're doing. It's like there's still fundamentals, this idea of a digital divide where not everybody might realize the benefits at the same speed or at the same time from developments in tech. I think this is as true as ever, you know, now. It doesn't really matter that, yes, internet's becoming used more widely. There's always something that comes to kind of supersede what's, you know, arrived before, and it's the speed of that arrival in different places. So I think that they really understand it. I think a lot of them actually, they get really involved in a lot of the project students we have, for example, in masters, they get very involved in designing and getting people to appraise what they've done as kind of as projects. And I think that process is really enjoyable. I think you can find out, you know, certain things by testing with one user, you know, whether your screen's going to load or whether your system is navigatable at all, or and things like this. But, you know, when you start actually getting to the greater numbers, it's that, I love those kind of sparks. You get the ideas flowing, people are coming back saying, well, actually this works for me in another context, and you start to get that richer depth of feedback. So, I mean, I would say a lot of the students have come to me seeing value in the process. And yeah, it's always that question of how many do I need to speak to, which I can never give a straight answer to.
No, there is no simple answer to that one, is there? And that's about not just having the usual suspects, as was spoken about before. And I think what you touch on there is also the work that you're doing, going towards what Alice is asking about. If those users, in your user-centered design, if they're elderly, let's broaden that to if there's anybody with different abilities and accessibility issues around technologies. You know, what can we do there? How do we reach out to those different pockets of population? Because they say that if we design it for accessibility, then it's accessible by all. So what are the special measures you take to make sure of that in user-centered design?
Yeah, I mean, I think the conversation's increasingly becoming a bit more disruptive there, and making sure that there's kind of networks. I think some of the comments from the other panel members about looking at people's networks from the folks you're speaking to are increasingly important. in studies I've been involved in, we've certainly offered, taxis for people to come in, whether you're very, very early on in ideation about something, doesn't really matter. I think that we're continually learning. There's a lot of citizen science kind of living lab projects that are coming out, say from Strathclyde, but also other institutions. I think there's a really strong need for it, because if we don't have these networks that are continually growing and so on, we're not going to reach the people who might, we need to think about different. It's not just about putting a flyer out on Twitter and hoping for the best. I think that it's this engagement piece. It's got to be, maybe it's down, a local church, a local sports hall, a local allotment. It could be on the high street. I think the presence of these kind of research questions, if you're dealing with citizens and looking, them looking after their health, I think we need to really be very diverse in our approach, because otherwise we do fall into this trap of this kind of, the kind of the same people maybe being asked the same thing. It takes time to build these links. I've been working at Strathclyde for 4 or 5 years, and I'd say now I'm learning more and more about the wider environment in Scotland, but some of our projects are trying to reach the whole of Scotland, and it just takes time to do it, but I think it's important. And yeah, it'll be something that we're continually learning from, getting more people in the room and being empowered with that voice. If you don't have them involved in the design, I can't really see how you are testing. How can you have them involved in implementation? I see it difficult. I think the two come together.
Yeah. Mark, Paula, Alan, anything to add to that? Okay, you're all speaking at once now. Or nobody. Mark's shaking his head. It's usually what he does when he looks at me.
No, not at all.
So who would like to say about how do we reach that wider groups? How do we bring them in? How do we actually, is there survey fatigue? How do we actually get people interested to take part, as well as reaching out to them?
I think there's definitely survey fatigue. And I think as well, with innovating products and services, when you're getting user feedback, you don't always need user feedback from hundreds and thousands. Sometimes there's the same, even with the mapping the learning journeys, when you're working even with 6 stakeholders, say from data analysts, understanding their learning journey, you find the same themes. If you're finding different variations, then you would open up the user group wider. And also for the user research, you need to make the effort when required to go out into where the users are and meet them face to face.
We've got a question from Hadi, who I just met last week at DigiFest. So hello, Hadi. One of the award winners from British Computer Society Health and Care Scotland. So nice to have you here. He says, how can we evaluate a system about the user-centeredness? Do we evaluate what we do?
I suppose, Katie and Hadi, from my point of view, is when we've done the user research and personas, we're then looking at the findings report. And from the findings report, that should help you evaluate if you're getting the right information to guide you on the developments of systems and doing things differently.
Mark, would you like to tell them about the lessons learned sessions that we have at the end of projects?
Yeah, I was thinking that, and I think just going back to what Paula said, I think if at the end of it you can sit back and you think, have I still got questions? You probably need to reach out a little bit more or find another group. But as a project lead, whenever we complete a piece of work or we actually get to a significant milestone, if it's a sort of multi-year piece, we would tend to sit back and actually do a lessons learned. And we're increasingly trying to get an independent facilitator in to do that, someone who is a colleague but not been directly involved in the project. And you're just trying to understand, what went well, what didn't go well, what can we do differently next time. and really take that critical view of how we've done it. So when we're looking at user research as part of that, we'd be looking at how we did the recruitment, how we got, what levels of engagement we got, what levels of engagement we didn't get specifically. Let's call out who didn't engage with us. How can we do that better next time to get these people involved, to get that group of people identified so we can draw them in. And that is one of the final documents we would pull together, and it's one of the key documents we would keep in a project, and we would refer back to it in other things. When I'm pulling together a project brief, one of the sections I always have in there myself is what lessons have we learned from different projects? What lessons have we learned from doing this before? So it's how do you understand, how can you take that critical view and take it in? And the good thing about having the independent facilitator in there and actually being that facilitator is it's easier for you to sit and sort of ask that daft laddie question, ask why did you do that, ask why didn't you do that, because you weren't involved. You're not sitting there going, oh, should I raise this or should I not? I'm not sure if that was something we should be talking about. You just say it, you just go for it, and you have that opportunity to challenge. And it's that time to reflect. And I think that's one thing we all need to do when we finish a piece of work or when we get through a piece of work, is reflect and think about it. And sometimes that's when you get your best ideas for the next time, because you've actually had the time to mull it over and think about it. Casey and I were on a piece of work recently and we needed to get to parents. And you're thinking, how do we get to parents? How do we identify a group? And we thought, well, we work in a team of 160, 170 people, most of whom are parents. There's our group. It's just sometimes you just have to sit back and think differently, and that lessons learned piece that you capture to feed on is a good time to do that.
Is there something about the culture as well that allows that?
I think where we are at the minute, we work in a project program management field. It's what we do. And I think that is definitely seen as part of what we do. It's part of the project, and it's the bit we know we need to do that mop up at the end. We can't just rush off and move on to the next thing. It's a hard thing to do, because even though it is part of our culture, it's not always the most natural or the easiest thing to pull together, because your team's starting to potentially disperse at this point. Yeah. As you get into the end of a piece of work, you've probably lost a lot of the team. How do you get them back in to do it? So it needs to be part of your culture. It needs to be part of, and it needs to, I think, just be part of your rigor, that you sit back and do that reflection piece.
Yeah, very true, very true. Alan, you're very quiet. What are your thoughts on what we've been saying?
My thoughts on that, I was going to turn on its head a bit there, because the local success of anything that comes through, I mean, obviously, because we're talking about, engagement with the right people, making sure we get the right people to, to feedback, all that kind of stuff. I'd say, at the centre point, sitting in the Scottish Government, the benefits realisation piece is particularly difficult at times, to get that national picture. And that in turn, that is a bit of a drawback in the terms of national promotion, about around health and care. And that's how you engage further and further, because you're always at the front seat of that. It's a prominent, I mean, the culture has changed radically since the pandemic, and we're still really building it, whether it be culture from the public side, culture from the staff side. The whole thing has changed radically, in the last couple of years. It's how we actually sustain that. But I say the benefit of realisation, there's great benefits going on at local level. But sometimes in the centre, there is a bit of a struggle to actually pull that together so that we can really demonstrate, what is happening. We know the good things are happening there, but how? I mean, I appreciate I'm throwing another question here that actually they're answering it, but how do we? I mean, I've always kind of scratched my head about how there's certain things that we can measure, but there's a lot of stuff out there that we probably aren't demonstrating, from a central strategic point of view. So I'm just throwing a question in. I mean, maybe someone on the call can add to that. But that is some things are pretty easy, in the sense that sometimes the technology level care stuff is a bit easier to demonstrate, because it's out there and people love it, and you know it's been out there for a while and it's had its own home. But some of the cultural benefits, the cultural changes and how we're engaging with people and what the benefits are overall, especially to newcomers, especially in the last couple of years where things have radically changed and people are striving for different services and different ways of engaging with their healthcare providers. So that stuff is still fairly new. So to realise the benefits that we've been achieving the last couple of years, sometimes I think we're selling ourselves short to some degree.
Yeah, and I think that goes back to what I was saying earlier on about adding value. So value is just a very broad term. It's in the same way that sustainability is such a broad term and can be used in so many different ways. So yeah, we do sometimes forget to add those in, I think. And sometimes we don't think of them actually until we do the lessons learned. Yeah. Strangely enough, because you can get too close to a project as well. I'm going away a bit from the user-centeredness. I'll just pull it back. Owen's been saying finding patients and citizens who are willing to share their, sorry, just admit somebody into the meeting, willing to share their experience of treatment and of recovery, their journey along the way. That user-centeredness that they can bring from that as well. Is this an avenue that we haven't covered in user-centeredness and recruitment? Is that an area we should be looking at?
I think, Katie, as well, there's potentially opportunities of when service users raise complaints, it's looking at the data from complaints as user feedback, because that will be showing the pain points within a service, and potentially it's using that data more. I'd imagine it is used, but it's about how we use it more. And about ultimately a lot of user-centered design is you're going out seeing people using the services. So whether you're having patient user groups of specific services and building that up, it's about how to get out and meet citizens and patients.
I wonder if there's an education piece around how as citizens we produce those complaints. I wonder if there's a way that we could facilitate people giving us that feedback and that we can take on board. And maybe it's cathartic for them to see us learning from it too.
Not just the case, I know just about maybe changing some of those patient forums. But I don't work closely with that kind of side of the house, but I mean, there's maybe a radical change needed there. That's a different kind of embracing where we're actually going with this stuff now. I don't know what's in a lot of that stuff, but maybe there's some questions and some other things that should be in that now. As I say, things as I've said 20 times, the things have radically changed, but have we caught up? With all these other patient forums and online and face all that kind of stuff that goes on. Is it just the same old, or is there some kind of new blood needing injected into that side of the house? I don't know.
Now, I think I did see a question coming in from Sharon. Following on from Alan, what Alan said, sometimes when you unleash the technology, there are outcomes that might surprise you, including the impact on users. Any examples of that, folks?
I don't have a specific example of the technology, but what I will say, that's a good point, because what I will say is sometimes I think we tend to jump ahead. There are some things that, because there's an over-keenness now to get stuff out there, and we did have that digital first approach that we said, and sometimes that can be taken out of context because we've changed a bit in the last 6 months, 8 months or so, and we're very much a blended approach now as per the digital health and care strategy. So the digital stuff is there, but it really has to be sensible and practical. So one example I will use on the back of that, though, is that well, it's been going for a while, but it's really come to the front now, the artificial intelligence piece, because we're already being asked for, what impact is this having on the service? What impact is it having on staff? What impact will have on workforce plan in the future? All those questions, and we're saying, whoa, we're still trying to scratch the surface of this. We don't know what the outcome. I mean, this isn't about replacing man with computer, side of things. But sometimes we do, in that context, we do sometimes want everything at once. And I think that stands the same for some of that technology as well. We need to get that. It needs to be practical, and it needs to be it needs to make sense rather than it just being something that's going to be, wheeled out, use it simply because we can.
So we're integrating service design modules in for professionals and for digital leaders of the future. Students are hearing about it to an extent as well. And I think we're pushing out in all directions, from academia, from health services, and from government. Are we bringing are there any areas that we're lacking in tools and approaches? Anything that or any new ones you've come across you thought, wow, that was amazing?
I think we're always on as much of a journey as we're trying to bring people along to thinking about using user-centered design. Every time we use it, we're picking up something new, we're thinking about it differently, we're adapting our approach based on our experience. The more we do, the better we become. The more we need to go out there and take it forward. There's a few comments tonight about looking at complaints or looking at customer feedback. Again, from a personal point, it's probably something I've not looked at much. When I've done this, it's not a source I've thought, let's go and see what comes back. But actually, it is something I would provide feedback to a store if they ask me, how was your experience? How was this? Can you provide feedback on the individual? And there are times you get that comment back saying, yeah, that's a good point, we'll take it forward. We're learning as much. I think we need to educate as we're going along.
Yeah, good points, Mark. Paula, Kieran, or actually all of you. We have to mention COVID at some point, don't we? Which approaches have worked for you during and post-COVID that we didn't really consider before? I mean, we've all gone on Teams now. It's made a massive difference to how we operate. What other technologies have you used that have helped you with user-centeredness during this time?
I mean, I'll maybe briefly say, just from developing apps and evaluating them, getting prototypes up there on Figma is really easy to get people to have a chance to see what things look like and interact with them and tell us what's working for them, what's not. Certainly throughout COVID, we were using things like Miro boards. Sometimes it's trying to get a concept together and allowing everyone to have a seat at the table. There's an interdependency that we have for everyone to be authentically listened to. And I think that I have been pleasantly surprised. I mean, obviously there's been so many challenges with COVID, but I was surprised about how well you could have those open conversations with people at distance. And also, if you're testing apps, things like that, well, I mean, when I started at Strathclyde, it was before COVID, and we would have face-to-face kind of user evaluations and kind of design sessions, whereas almost every kind of evaluation or project that I've been involved in has had some degree of kind of, online functionality testing and so on. And we still managed to develop personalization. We still managed to have those agile sprints. It has worked quite well. So I would say COVID has been something that we've had to work around with. I think in some ways it's impossible to know the overall impact on that and what would have happened if it was face-to-face. I think that'd be an interesting study, but certainly when you look at the kind of end evaluations that we were doing, we're still getting, quality data to suggest that the usability was on a very good level from in-app data and kind of outcome measures that we evaluated after studies.
And Paula, anything to add in there?
I think COVID demonstrated that people could adopt technology at speed, and providing listening to users and providing the resources to support that at speed what we need to do is continue that fast-paced, agile approach so that it makes innovation and the new rollout of technology, processes, systems quicker, and that we don't revert back to new ways of working, old ways of working. Even home working was new for some, but in other sectors that's been happening a long time. And when we think about how we attract new people into this sector, sometimes it's the technology gap that we need to look at rather than the digital skills gap, because from our user research, people have got the skills, sometimes the tech's not there.
And the affordability around it as well. One of our prize-winning posters at Digifest last week was comparing really entry-level, low-tech communication systems for people to use. And it was a tremendous study. I can't remember the name right now of the person. Is that terrible? Shona, I think. Shona Aldridge. It comes back to me eventually, doesn't it? So yeah, it's the low tech as well as the high tech, and what we can gain from it too. Yeah. So there are still people doing research around what can we get the most out of without, but being the most accessible as well. From that point of view. So it was amazing to see the range of posters last week, and you could see the user-centeredness in it. They were speaking to real people, they were talking about what those people were saying, and they were really representing the voices, which was wonderful to hear. Always enjoy that kind of research. So we've got 5 minutes left, folks. So let's go right back to the start and let's check. We're talking about user-centered design approaches and tools for digital health and care strategies. Maybe we've not done quite so much in the strategies. Alan, you've certainly talked a wee bit in that direction. Where's this going to go next? What do we need built into strategies that would actually put the user at the centre of what we're doing in health and care?
Well, we've just published the delivery plan that will deliver the digital health and care strategy. Of course, it doesn't go in every nook and cranny, the digital health and care strategy. It takes a sensible approach of what we can achieve, over the next year or so. But it's also forward looking as well, because it does highlight some areas where we know we can actually build on it. And I thought I'd dare say that's one of the areas. But it's the user side for me, as I said right at the beginning, it's about the two-way communication there, and using the pooled resources to the best value that we actually can. We know there's a lot going on there locally. It's about it's about pulling that stuff back into the centre, and that comes back down to the benefits. So I think moving forward, I mean, we have got in the governance structure we have got that sewn up anyway, as I say, because I said at the start we've got the digital citizen closely linked up with the digital technology. But where we can go for this, we can actually make that link better, and that's where the outcome of all this stuff, as it's coming through, if that's all cascaded back in, then that should work from the centre driving back out, if that makes sense.
Makes perfect sense, and and given that you've got the strategies for what you're going to do each year, I think it's really nailing it.
It's much more explicit in terms of what exactly we are going to do. So as I say, it doesn't try to drive everything at once. It's very realistic over the next year or so.
Yeah, and I mean that was reported on quite heavily again at Digifest 2022. So if you want to go back and watch the recordings, it's there. There was about the National Digital Platform, the National Care Service, and there was quite a lot in care homes as well. And all the posters are there too. They're on the Learning Toolkit, a marvellous digital tool again.
I'm quite excited, but it's only in recent times that we've actually married up the digital side with the citizen side, and that's really come together, because they were quite separate entities, to one point. So all this e-health, it's all under the digital health and care umbrella now, and it's still, this is our second strategy, but it's still fairly new, because this is the only one that we've actually got now with our actual delivery plan on it. So while we're setting the scene and changing the culture, we are really delivering on this now, and that's why that stuff it's still fairly new.
Yeah, and Paula, do you see anything around where you're working in NES and what you're delivering there, and how that's more strategic now around digital health?
So even when you look at the launch of our Leading Digital Transformation in Health and Care for Scotland master's programme, that's targeted at individuals who are operating in the context of a role where they're required to drive and implement practical digital transformation. And so we've got 60 places on that programme. So that's part of our strategy and delivery of the programme. And the next part that we're away to design is digital mindset classes at executive level. So it's about how we can scale across the sector and widen people that are part of the programs and using the resources that we're creating and sharing.
That sounds amazing. Wow. So Kieran, Mark, you've got 1 minute each. How are we doing for our strategies? We've got the tools and approaches. Are we taking a strategic viewpoint on it?
I'll maybe jump in here. I mean, for me, strategies ahead, I just feel like citizens are going to be, they're increasingly empowered with so much knowledge about their health, including digitally. It's turning that into something that's around salutogenesis, is about creating wellness. I think that, you know, there's a big conversation there about how that works. I know DHI and many others are doing some great, you know, initiatives around it all. But it's basically that concept of creating wellness for me, because it fits around themes of healthy aging, but that's what the future looks like for me. It's about giving people the tools, the training, the support to help look after their own health and stay well for as long as possible, alongside kind of healthcare, you know, that's obviously there at the point of need.
Mark, I'm going to give you the last word and then I'll close out.
I think in terms of strategy, there's always room for improvement. If we've got the strategies at the top, right, we've just got to filter it down as quickly as we can to the projects on the ground, to make sure that they take the same approach and they're taking that into consideration when they're delivering anything, get the best value out of it, but also make sure it's hitting that digital strategy.
Absolutely. Folks, thank you so much for coming along, and a special big thank you to our panel tonight. You've all been amazing. Paula, Kieran, Alan and Mark. As I say, the session's been recorded. We will get it posted up on our British Computer Society Health and Care page. And we're delighted to have been able to run 2 different satellite sessions for DigiFest 2022. And I'd strongly recommend you go and visit the website and have a look at the recordings from that as well, and the amazing posters. Those amazing posters will get highlighted more. Sharona had the idea that we invite people back from DigiFest poster sessions to actually give us talks. So the winners and runners up will be coming along from both service development and from research projects too. And there was some wonderful stuff there around care homes that I'm going to go back to people about, and digital tools that are happening there. And there was also health inequalities. There was a lot around helping drug recovery and saving lives through a sensor that's been developed as well, and around the well-being of prisoners when they're released from prison, and the social inequalities that are there and what we can do to sort of level things out. So there was a lot there. Go and have a look at it all. Thank you for coming along tonight. It's wonderful to have a big crowd, and the recording will be there for you to look at afterwards. Thanks very much, folks. Bye.